Hey, welcome to our newsletter for March of 2020. We're going to forego our typical newsletter introduction and just spend a few minutes to talk about COVID 19. I think it's worthwhile that we share a little bit of information. And as always, Dr. Abraham and I remain available to you and happy to answer questions. If you shoot us an email, shoot us a text. We're happy to work with you and in your agencies on this as we are about to enter a marathon component of caring for people with COVID 19. Fortunately, as of this recording, we don't have community spread in our response areas, but it's sure to come and will be probably within the next few days or weeks time period that it will hit in our particular area. We've been following closely with our colleagues around the world. I've been in touch with EMS medical directors literally throughout the US, Europe, Asia, over on a daily basis, checking in with them, coordinating some educational events, and talking with them, so that I feel we have a good exposure to what's happening on the world in the world, and particularly with our colleagues in Washington, Seattle area, where we're able to follow some of their policies and procedures that they're sharing with us. What we want you to do is spend a few minutes and make sure that you're following all of the reliable sites that are out there and resources when it comes to COVID 19. We want you to be responsible. We don't need you to overreact, but we do need you to take it seriously, as there are some implications of coronavirus and COVID 19, and we want you to be prepared for it, particularly in the EMS world, and also be aware of how it will affect our healthcare system as in the numbers of patients increase and the worried well look for your compassion and your care that goes along with that. When it comes to our area, again, we'll take additional steps when we determine and see the community spread, which essentially means that we see cases of COVID 19 that aren't related to travel. What we want you to think about is what's the appropriate personal protective equipment that's out there, and following the current CDC recommendations. We certainly want to follow the guidance that is reasonable, and currently that includes the N95 mask, goggles, and face protection. I prefer the full face shield if fully available, gowns, and gloves. You have to make sure that you know how to properly don and doff your PPE. So again, if your agency hasn't already done that and had you practice, now's the time to do that and be able to prepare for it. Travel is essentially where we've seen most of the cases associated with COVID 19 so far. We're seeing, again, a number of areas throughout the U.S. with pockets in New York, Florida, and again, here in Texas, we're seeing it in the Houston area as well. Most of them have been associated with travel exposures, and so again, over the next few months, you'll have to evaluate and follow your company policies about travel in and around the United States. And again, it will be probably dependent upon your specific employer and the place that you're wanting to travel as to whether or not that would be considered safe at that particular time. Right now, we have questions that are based on travel history with our dispatchers, and with a positive history of flu-like illness and respiratory symptoms. We should be aware of that and a notification sent to you. But this is not foolproof, and so again, I want you to be in the consideration mode that if you're responding to a patient with a respiratory illness, we want you to go ahead and make sure that you're utilizing the appropriate PPE regardless of travel history. This will be particularly important, and we'll emphasize this once we have, again, confirmed community spread type of cases in our area. Contacting the medical director once you receive a notification that you might be contacting a patient with potential COVID is important for us. We want to help coordinate your care. And then obviously once you make contact, we'll have you coordinate with the MedCom in order to look at destination or potential transportation, or even what some people would refer to as a no-load, where we don't transport the patient. Again, that will come with consultation, and this will be a slow, methodical process. We won't be urgently rushing in and caring for these patients. We want you to maintain your social distancing, and that may include just instead of sending an engine company and EMS unit in to evaluate a patient, talk with the patient through a door or on the phone first, and then gather and ascertain more information, and then determine if you need to evaluate the patient in person, again, in conjunction with the medical direction and your supervisors. Other areas that we want to look at, again, whether those patients will require transport and hospitalization, whether they may be monitored at home and treated at home and followed by our public health authorities in our response areas. Again, and this will take conversations and discussions in order to look at those particular type of patients. Also, what can you do to protect yourself? Well, again, all the things that you've been hearing in the media to look at ways of social distancing, stay away from other people by about 6 feet or so. Washing your hands can maybe not continuously, but certainly often, particularly after any patient contacts and interactions. Wiping down surfaces with appropriate disinfectant and cleansing agents will be important. Coughing or sneezing into the crook of your elbow. Again, all things that we've talked about and are trying to prepare you for. These are just serving as reminders for us. Again, once the COVID-19 hits our area with community spread, we'll send out additional directives and talk about and reemphasize these things of minimizing the contact, again, minimal people that would approach the patient, assuring you're wearing your appropriate PPE for those exposures, looking at potentially using a metered dose inhaler for administration of beta agonists as opposed to nebulized treatment where you have increased droplet spread. There is some controversy in the medical field right now about which is better of non-invasive ventilation or endotracheal intubation. We know there's increased risk with endotracheal intubation and healthcare worker exposure. And then when we look at non-invasive ventilation, some people feel that that is more likely to increase droplet spread. So we'll have additional conversations and different discussions regarding that as time moves forward. In our particular region, there will be specific destination facilities where we will transport these patients to that have the potential for COVID exposure or, again, potential monitoring, and we'll coordinate that through the MedCom, through the procedures that have been shared with you. There may be alternative entrances to the facilities. You may not go through the emergency department. The patient may be considered a direct admission. And again, this will be slow and methodical, and we'll work through the coordination phase with that. Then after your transport of patients or the potential exposure to a patient in the back of your ambulance, we'll need to decontaminate the ambulance. And right now, the CDC recommendations includes using your typical contact disinfectant that is appropriate for coronaviruses. Each of them have a different contact time, and you'll need to do what is specific to your agent and your agency policy and procedures with that for cleaning and disinfecting the equipment and the ambulance itself. There are some additional measures that people are looking into, such as ultraviolet lights, hydrogen peroxide contact spray, and other means of disinfection. Again, your agency will provide you additional information that is specific to your situation. What about yourself and your family? Again, what we want you to do is make sure that you're protecting not only you, but your families, and we want you to minimize those worries and concerns. So those same actions, such as washing your hands at work, all those things apply at home as well. You may want to consider changing your clothes or uniform before you go home, going into the garage or the backyard and changing into a clean set of clothes. Having multiple uniforms at work is probably worthwhile as well, so that if you have a potential exposure, you can change your uniform that goes with that. And remember that if you're utilizing appropriate PPE, even if the patient is a known COVID patient or becomes a known COVID patient, as long as you're wearing appropriate PPE, we would not consider that an exposure, nor need to quarantine you after that. Again, the emphasis on using the appropriate PPE that goes with that. Now you ask, what if you do have an exposure? And like we said, if you're wearing the appropriate PPE, we're not going to be as concerned about that. If you were to have an inadvertent exposure where Patient was transported, you picked them up for a fall or weakness, and they ended up having COVID 19 or a coronavirus. If that patient is tested positive at some point in their career or in their hospitalization process, you would be notified by our Metro Health or Public Health Authority, and they might consider continued monitoring for you, and perhaps doing a quarantine at home. If that's the case, you would be asked to stay at home, be separated from your family members, have separate meals, stay in a separate room, preferably a separate bathroom, and during that 14-day quarantine period. We transition the terminology to isolation if you were to develop symptoms such as a fever or cough, where again we'd have continual or additional monitoring, but you may still be able to stay at home for additional treatment and evaluation. It doesn't necessarily mean that you would be required to go to the hospital. Each agency will determine their policies and procedures of how they'll do that with you, and whether there are any other additional paperwork issues, workman's comps issues are not clear at this point in time, but some of the national agencies are and organizations are trying to work on that for you. Once you're cleared back for duty, again, that would be developed or be dependent on the policies that you would see with your agency. Typically at home, if we're monitoring you, we'd ask you to take your temperature twice a day, and you can take some of the medications that you normally would for a viral type illness if you became symptomatic. That isolation at home, again, is going to become an important factor, not only for pre-hospital providers, but many work type of environments. And in fact, many institutions are looking at ways that people can work effectively from home as well. Again, the important points there are, again, you'll follow with what your leadership has to say, what policies they put in place, and we'll continue to follow the situation as it develops for us. And so, again, Dr. Abraham and I want to remain available to you. We want to answer any questions you have for us. We'll probably be doing a few town hall meetings via a Zoom type of webinar in the future. We're working issues with the chiefs and the leadership of the EMS and fire agencies that we work with. And again, please let us know your questions. Otherwise, be safe. Make sure you're washing your hands. Get your flu shot if you haven't already done that. And maintain your social distancing, and avoid all of the potential contact areas if at all possible. So again, good luck, stay safe, keep us posted, let us know what your questions are. Thanks, and have a great day.